everyone. I'm Doris McMillon, and welcome to Inner Health, Outer Beauty, where we shatter the myths about health and we talk about the latest and greatest in cosmetic procedures and how they can work for you. Now, today, we're going to flip the script. Normally, it's Dr. Wanda Dyson who is doing the asking, and the person sitting where I am would be answering the questions. But she's got so much great information today that I've got to ask her some very important questions. So here we go. I have a little story to tell you. In my past career, I was a news anchor and a talk show host. And I remember interviewing some doctors who worked for the U.S. Army, and they worked in the biological warfare division. And so we were having a conversation, and I said, "Hey, doc, I've got a dent right between my eyes. In fact, it was so deep, you could have dropped a quarter and you might have gotten change back." I said, "What can I do about this?" And he said, "Botox." I said, "Botox?" And he said, "Yeah, you want the dent to go away, right?" But I'm thinking, Botox, botulinum, poison. You want me to put poison in my head? So anyway, that brings me back to what we're going to be talking about today, and that is Botox. So Dr. Wanda, please tell us, what is Botox? As you can see, I'm still here, so I didn't die, right?
You're still here. And Botox has been used for cosmetic purposes since 2002, and I've been injecting it since 2004. And it's a purified protein derivative of a toxin produced by a bacteria.
So how does it work?
So what it does is it relaxes the nerve that goes to the muscle, and then your muscles smooth out. And it's usually used on your muscles of facial expression, like the muscles, they call them the 11s now for short, but the muscles between your two eyebrows, and also when you raise your forehead, you see some lines there. It's used to relax those, as well as what we call the crow's feet.
Okay, so when somebody lifts their eyebrows and they get these furrows, I call that the Shar-Pei puppy look. They look
Yes.
like one of those puppies that has a lot of loose skin. So the Botox will kind of tighten that up?
Yes, it would smooth it out.
Mm-hmm. And for the dent that I had between my eyes, because I think I used to squint a lot when I would speak, and I would have this dent, and even after I was through speaking, the dent was still there. So how does it take care of that?
In the same way, it relaxes the nerve that goes to the muscle, and it smooths those muscles out. Now, mind you, some people wait very long before they start their treatment, and they may end up with a crease that's hard to totally remove. So it's really good to start this treatment early. And a lot of my patients in my practice start in their 20s.
All right. Now, when this doctor told me that it was botulinum, I'm thinking poison. But is it poison? I mean, obviously I'm not dead, so how bad could it be?
It does come from the toxin from Clostridia, which is the bacteria that can cause botulism. But it is a purified derivative, so we don't have the risk of that issue, unless we get some bootleg botulinum toxin.
Which means it's very important that when you go to a medical professional, you know who they are, what their credentials are, and is this something that they do on a regular basis? Is that fair to say?
Yes, make sure they're experienced. Now, people have gotten into trouble by going to beauty salons or estheticians or people who are not even licensed physicians or nurse practitioners to get this done. So don't try to be cheap, because in the long run, it's going to cost you more money or perhaps some side effects.
Okay. How long does it last?
In general, it lasts for 3 months, but I do have some patients that last up to 6 months. So it's very individual, and we have to see based on your experience with the product. If it's your first time, I wouldn't know. So we will see after the first treatment how long it lasts in you.
How do you know how much you need? Now, I remember when I came to your office and you gave me some Botox in my forehead and between my eyes. How did you know how much I needed?
Well, I would say it's based on 18 years experience, but there are some people who are very sensitive to Botox and they need what I call like a baby Botox dose, like very, very minimal. But most times they've already been to another physician and they bring those records with them. So I just follow those previous guidelines of how much they were given. But in general, I am basing it on my experience.
Okay. What does it cost?
Well, it depends on the physician that you're seeing and how they're doing it. Some people charge per area. Some people charge per unit. Now, we don't all get the same amount of Botox. Some people get as little, in my practice, as 10 units. And there are others who get as much as 50 or even close to 100 units. So I personally charge by the unit, so you're paying for what you get. But in other practices, you may be paying by the area, irrespective of how much you're getting. So if you're getting 10 units, you're paying the same amount as someone who's getting 50 or even 100 units.
Okay. But overall, it helps delay that aging process. Is that fair to say?
I would say it helps to prevent a permanent crease there. It opens up the eyebrows and it gives them some lift. If you're getting like droopiness with the eyelids as we get older, the eyebrows are falling, it helps to lift that up. The brows in the middle area, but also laterally on the outside. We can pull that up by injecting the lateral aspect of the eyebrows as well.
All right. So how long have people been using Botox cosmetically?
It's been used cosmetically since 2002. And as I said earlier, I've been injecting it since 2004, so almost since the beginning.
Okay. Now, I'd like to shift because there's another product or procedure I'd like to talk about. And I think it can be used in tandem with the Botox. And it's what I've been hearing, they're called fillers, where they fill up empty spaces, for lack of a better description, on your face.
People get fillers and Botox confused. They don't know the difference. They do two different things. Fillers are not for wrinkles. It's not for the motion of frowning or movement of the muscles in the face. Fillers are more for filling in the volume that we lose as we age. And there are different types of fillers. There are most commonly, you've heard of hyaluronic acid fillers like Juvederm or Restylane, but there are many other types of fillers, and I inject most of them that are available on the market.
Okay, so as we get older, one of the things that I've noticed is that the area around the eyes starts to hollow out. You start to get these deep laugh lines. Again, look like you could insert a few quarters in there and, you might get some change back. But as we age, our skin starts to drop. How do the fillers plump us back up?
So you mentioned a couple of areas, and one was the hollows under the eyes. You can use fillers under the eyes to plump that area up, but I personally prefer not to use filler in that area because they have found that the fillers can track behind the eyeballs, and I don't want that. That's a complication of fillers. They can see that when they do like MRI scans or something. I prefer to use PRF gel, which is a product that comes from your own body. I draw your blood, I make a gel of it. It has growth factors in it that fill out those hollows. So that is a better option, and that can't cause any harm because it's your own body.
Okay. What about the laugh lines? What can we do about those?
The laugh lines, to me, injecting the laugh lines themselves are, that's a very novice injector.
Mm-hmm.
That really the issue is not the laugh lines. The face falls from above. It falls downward and forward. So the treatment to get the face back into place is to pull it back and upward. And that can be done in many different ways, one of which is PDO threads, but you can also fill the face back up with filler, and the temporal areas become hollow. So filling that area back up can bring the face back into place. Also, bringing back the volume. If you have very sunken cheeks, the cheeks have lost volume. The cheeks lose hyaluronic acid, they lose fat, they lose bone, and you lose collagen as well. So and muscle. So you can use what we call biostimulators, and that would be fillers such as Radiesse, which helps to restore the collagen and also the elastin of the face. You can use PRF gel, which helps to restore the bone, the fat, the muscle, and those are called biostimulators. You can also use Sculptra there, which is another biostimulator, which helps to rejuvenate those areas. I also like to fill in volume. Mm-hmm. If they've had a lot of loss in volume and they're 60, 50, 60 years old, I may use both. I may use a filler such as hyaluronic acid, and then I might also rejuvenate the face with PRF gel.
Okay. At what age are you seeing your patients coming in to get these fillers? Because the last thing I know we women and men want to do or don't want to do is we don't want to look tired and worn out and beat up. You know, we want to look refreshed. So at what age are you seeing your patients start to come in?
Well, I would say they come in mainly in their 50s and 60s. Mm-hmm. And I think they have unrealistic expectations of what can be done because they've never had anything done. Mm-hmm. And there's a rule of thumb, and that rule of thumb is that for each decade, we need 1 syringe of fillers. So if you come in at 60, that's 6 syringes. If you come in at 50, that's 5 syringes. But it doesn't always hold true because the person may respond very well and quickly to it. So they may need less than the amount, I think, based on their age, or they could need more.
Okay, and how long do the fillers last?
It depends on the fillers. We have lots of different classes of fillers, but mainly the ones that I use, Restylane Lift or Juvederm Voluma, Restylane Lift lasts about 18 months and Voluma lasts 2 years. There are also other fillers on the market, such as Bellafill, which is a collagen filler with PMMA, which stimulates your own body to produce collagen, and that one lasts about 5 years.
Okay. What's the cost involved here? I know there are folks who are watching this saying, well, what do I need to start saving for?
Well, as I said, it depends on your age. That determines the number of fillers that you need. So if you're 60 years old, that's about 6 fillers. And on average, I charge about $800 per syringe for the ones that are longer lasting. Mm-hmm. I sometimes have promotions and specials, or if a patient gets a great number of fillers, then I will give them some sort of discount.
Yeah, a lot of what we're doing as we age is we want to feel good about ourselves. We want to look good. And these fillers, the Botox, provide an opportunity for people to look as good as they can look. So what do you say to the person who's like sitting on the fence saying, oh, I don't know. What should I do? What should they do?
What I say to them when they come to my practice is the longer you wait, the more it takes. Meaning the more fillers you need, the more money it's going to cost, the more time it's going to take to arrive at your desired result. So the longer you wait, it doesn't make it less expensive, it makes it more expensive. And your result is just going to take longer.
Okay. Now, I wanted to ask you about one other filler. I watch Access Hollywood because I like to see what the stars are doing. And some of the women I have seen, if you see pictures of them when they first started in their acting careers, they had very thin lips. Now, fast forward a few years and they're very successful. They've got more lips than you know what to do with. What are they doing?
They are probably using hyaluronic acid fillers like Juvederm. You can also use Bellaterol in the lips. But I think in Hollywood, they go a little bit too far. And my practice is located in Washington, D.C. on Capitol Hill. And we tend to be a lot more conservative here. And none of my patients want to look like that. And they all say, please don't make me look like Angelina Jolie. And I don't give them that look.